Welcome to TCN Talks. The goal of our podcast is 15 to 20 minutes of relevant, need-to-know information to help you in your role as a hospice, palliative care, and serious illness leader, and for the team at all levels of the organization. Our goal is concise and relevant information because brevity signals respect. And the bookends of our podcast are always something to make you think deeper about life, about our topic, or both. And now, here's Chris Como.
Hello and welcome. Before we get started today, I want to thank our sponsor, Delta Care RX. Delta Care RX is the title sponsor for all of our 2023 TCN Talks podcast, but also our TCN Teleas Leadership Immersion course. Delta Care RX is primarily known as a national PBM and a prescription mail order company. Delta Care RX is a premier vendor of TCN. They provide not only pharmaceutical care, but they also provide niche software innovations that save their customers, our members, time, stress, and money. So we want to thank Delta Care RX for all the great work that they do in end-of-life care and serious illness care. And also, again, always a point out, coming up, our TCN Leadership Immersion course is the week of May the 1st. This training has been reviewed as some of the most potent and powerful leadership training in the hospice and palliative care space that many leaders have ever been through. Join us. Go to teleascn.org and look under courses. Also, whatever platform you're listening to, we're getting some great feedback and more followership. Be sure to subscribe. That way you're notified every time we have a new episode, and we got a lot of great episodes planned for this year. So back, a show that we're going to do all this year. And Mark Cohen, welcome back again today.
Hey, Chris, thank you. I'm glad to be back. It was fun last time.
I got a lot of great feedback about this show because I think we're actually providing a service for many hospice leaders. And I know your heart, and that's my heart as well, is just to be a service to people. So that might be a good, Mark, I think it's always great for our audience to know something, in your case, new about you. So what would you want them to know?
Well, on Inauguration Day 1977, I was the youngest person to walk into the White House as a member of the president's staff, President Carter's staff. I had dropped out, left college in January of 76 to join the primary campaign before any votes had been taken, and went through the primaries, the general election. I served in Plains on the very small staff that was with President Carter during the transition, and went back to Washington with him and worked in the press office, monitoring the media for the administration for my first 2.5 years in the White House.
Well, we're going to leave him with a cliffhanger because one just has to wonder then, how in the heck did you end up in hospice? So we'll leave that as a cliffhanger when you and I do March's stories of the month, if that's okay. Well, Mark, thanks for coming back. So Mark and I I approached him after the holidays, and we did this for January. And I said, I think it'd be a great service because we always want to do TCN Talks to add value for others. And I've heard a lot of CEOs say, man, Mark's newsletter, Hospice News Today, is incredible, but I just don't have the time to keep up with it. So what Mark and I are doing each month of the year this year is the top news stories of the month. And what I love, and Mark and I didn't totally say, hey, here's going to be your approach, here's going to be my approach. We just naturally did it out of our different purview. And Mark, you've done it from more of a quantitative analysis approach, and I've done it from the approach of, as a hospice and palliative care CEO, what do I think they need to know? And I think I've gotten such great feedback last month. Folks said, man, that was awesome, because there's some that I missed, I didn't get to. And having both Mark's approach and your approach is like literally taking a coin and flipping both sides. So I think we're adding value. So how about we continue it?
Okay, great. Well, I'm looking forward to hearing your top 10 this month. My top 10, the obvious answer for number one is former President Jimmy Carter's decision to be admitted to hospice, which was announced on February 18. There have been literally 3,000 plus articles in the broadcast media and the print media about President Carter's decision. But what's really important from the hospice perspective is that just about every article about the decision, presented hospice in a positive light, talked about why he and his family had decided to go into hospice care, to get out of the hospital and go back home. And then what's been truly amazing is the number of articles that have run since then that have done what we call Hospice 101. President Carter has decided to go into hospice. What does that mean? Or, what is hospice? And it just when I'm reviewing my clips every day, I mean, it's been 300, 400, 500 clips a day every day since that. And a lot of repetition, a huge amount of repetition, but that just means that the story is running in almost every market where there's a hospice provider. This has been run. So in the end, it's a great opportunity for hospice providers everywhere to talk about the care they provide, to talk about how they can support families dealing with a life-limiting illness, and to talk about the fact that hospice isn't about death. It's about quality of life. So just a huge positive hit for hospice at a time when some of the most important national coverage has not been all that positive, which leads to my second, I think, most significant coverage of the month, which is the continued fallout from the December article that ProPublica and the New Yorker published on the failings of a significant portion of for-profit hospices. The follow-up this month has been a bit of a hodgepodge. There have been editorial pieces written, say, by physicians or by hospice CEOs defending hospice or talking about the not-for-profit care standard in hospice. The most significant news that came out of the follow-up this month was when 4 provider groups, NHPCO, National Partnership for Healthcare and Hospice Innovation, the National Association for Home Care and Hospice, and Leading Age, met with the administrator of CMS and presented a list of nearly 36 reforms to deal with the abuses that were detailed in the ProPublica article and previously in articles by the LA Times and others. There also was action in Congress that got covered, a bipartisan letter that called on CMS to increase oversight of for-profit hospice. So the story continues to move, not quite as sensationally as when it dropped in December, but it is still out there. Also out there in a huge way, because legislatures are in session, is physician-assisted suicide, medical aid, and dying. I counted 35 articles in the past month on this subject, a wide range of articles, lots of discussion about expansion of medical aid and dying in places like California and Oregon and Canada. Other states like Rhode Island, Florida, and Minnesota have seen newly introduced efforts to begin the conversation in their states. Other states that have been close to passing it, the lobbying continues there: Massachusetts, Connecticut, New York, 3 prime examples. Then we had a case in Montana where it's the only state where physician-assisted suicide wasn't created by virtue of a citizen referendum or by legislative fiat. It was a judicial decision that left the door open for the legislature to overrule the judiciary. There was a movement in the Montana legislature just this week, the 3rd week in February, to change the law there to make it illegal for physicians to participate in physician-assisted suicide. On first read, the legislation passed 26-24 with 8 Republicans joining Democrats in opposition. And on second reading on February 22, 4 members switched their votes. 3 yeses became noes, 1 no became a yes, and by the same 26-24 margin, the bill was defeated this year. So it would appear that physician-assisted suicide is safe in Montana for another year. Also with legislatures in session, 19 articles this past month about efforts to approve medical marijuana in the handful of states where medical marijuana is still not allowed or where it's very restricted. And a corollary to that is there were 5 articles in the last month about efforts to legalize at the state level use of psilocybin or magic mushrooms. And I think that story seems to be gaining some traction. It'll be interesting to see what happens after the legislatures adjourn, whether that continues or whether it will have been a legislative session kind of thing. But states are moving in that direction far faster than the FDA, the Food and Drug Administration, is. Next up, series of 3 related topics. Staffing shortages across the continuum of care. I counted 21 articles that were of specific interest to hospice providers. Not all of them were specifically about hospice. Most of them, in fact, were not. What I didn't count in that 21 were all the stories about layoffs in the hospital sector or specific problems with staffing in the skilled nursing sector. If I had counted all those, there probably would have been 50 articles on that this past month. Then 17 articles about nurse burnout, nurses issuing strike notices, nurses going on strike. There is just a continued amount of discord, particularly focused, but not exclusively focused, on the hospital side with nurses. And that represents both a threat and an opportunity to hospice providers. Those hospice providers that pride themselves on being employers of choice, there is a continuing burnt out sector elsewhere in healthcare that will be ripe for recruitment, frankly. And then the fallout from the nursing school diploma, the diploma mill scandal in Florida. I counted 10 articles in the last month where states like Texas, Delaware, New York, Florida were starting to go after nurses who had graduated from those diploma mills. I don't think the story's done. There's a lot more states out there that haven't spoken out on this yet. It continues to bear watching, I think. Then there was a huge drop-off in coverage of issues of interest to hospice. There were 3 stories about political entities questioning the not-for-profit status of healthcare providers, whether they indeed were earning that designation. That was at the hospital level, but I believe it's always a risk for not-for-profit providers anywhere in healthcare when people question what the large, profitable not-for-profit hospital systems are doing with their tax-exempt designation. There were 3 significant voluntary retirements in the hospice world that got media coverage. Hospice by the Bay Health, and I have to go check my notes. I'm drawing a blank.
Yeah, you're making me wonder. I'm like, who were those? But I do remember the Hospice
by the Bay Health and Calvary Hospice in New York and Hospice of the Piedmont in Central Virginia. Those CEOs announced their retirement. They all got really nice local coverage. And then the last one doesn't deserve to be here by virtue of the number of clips, but I found it interesting that 2 media 500 miles apart basically wrote the same story, and that's about, in the area of grief and bereavement, wind phones, where volunteers construct an old-style phone booth and put an old-style phone in there that is not connected to anything, and its purpose is to be a safe place for the bereaved, no matter how recently or how long ago they lost a loved one, a safe place for them to go and talk to the person that they lost. And there was a newspaper in Tennessee, a TV station in Tennessee that did a lengthy story on this, and then the Tampa Bay Times in Florida wrote a story about it February 21 or so. So I think that's interesting. It's the concept of a wind phone started in Japan, both of the news articles that ran this month mentioned that they're popping up in other places. So I think it's important for hospices to be aware of this. Hospices that have bereavement gardens, pathways on their campuses might want to think about adding a wind phone to the various amenities they have on their campus. It's an interesting concept, and it gets great favorable coverage. My honorable mentions were hospital closures, either the hospital itself or significant services within a hospital, continuing focus on rural healthcare deserts in general, continuing focus on Medicare Advantage. Most specifically this past month, the coverage was how the heck can home health providers get a piece of the Medicare Advantage pie and not go broke in the process. Amedisys has been very outspoken on that in the last month. And then the unwinding of the public health emergency and what that means for healthcare and what that means for the waivers, and some of which might stay, some of which are going to go away. So that's my quantitative look, Chris, at hospice in the news for most of February.
Awesome, Mark. Well, thank you. I was just sitting here thinking, just listening to you and putting my like hat that I used to wear as a hospice CEO. It's a great service what you just did, because what I was asking myself is, if I was still a hospice CEO, I work with many CEOs now, my role is different. I would need to know about everything you just said quantitatively and ask myself, what is our position as an organization, as a CEO for each of those things? We use an analogy. I had a credible high school football coach. He was a Japanese American and just poured into us. Coach Nagata was his name. And he said the game of football is pretty simple. You just got to get a helmet on the other guy, and if you got a talented person with a football, you win. You win every time. You score a touchdown. Well, I was listening to you and thinking about, as a hospice CEO, do we have a helmet on that? Do we have a helmet on that from a quantitative standpoint? And there are a couple in there. I'm like, if I was a hospice CEO, like the wind phone idea, like, yeah, what do you do with that? What would you do about that? So thank you. You always knock it out of the park. So let me go ahead and try to take a shot as well with a different viewpoint. So one of my mentors, a guy named Dr. Lee Thayer, taught me the concept of need to know. So I tried to think, okay, what would CEOs need to know? Mine is not quantitative from Mark's, but there's some interesting pearls this month. And the first one, I almost demoted this one to honorable mention, but it's an article about Avonlea, or I think it's Avonlea Care, joins forces with Walmart on caregiver support. And so basically, beginning February, the app will include curated shopping lists specific to seniors' health needs, such as gluten-free, dairy-free, low-sodium, diabetic-friendly groceries, post-surgery support, and adaptive equipment. So basically, it's a mobile app designed to support family caregivers. So they're partnering with Walmart. And Mark, I was thinking about my time at Home Care 100 this year, and such an incredible smorgasbord of technology that's coming to healthcare. And I think as healthcare people, Mark, you've probably seen this over your career as well. We have this syndrome like we got to do it on our own. Well, I got to go and create an app like that. But I think collaboration and technology stacks are going to be so much a part of the future. Like you better go, well, I can't do that. Well, is there a way that you can take an idea like that and partner with something that already exists? And that's why I felt like that article was important, not necessarily about the specific tech, but just the concept of, wow, these guys are smart. They approach Walmart. What a great partnership. And I think probably technology ecosystems are going to be pretty important to the future. The second one, which is going to be interesting because I'm going to have Jay Cushman coming up in a show, and we're actually going to be talking about data. And so this article was, why are so many Americans dying right now? And they had some stats in here that intuitively I've heard Jay do some research, but more than 300,000 additional Americans have died over the past 3 years, whom we would not have expected normal times. In other words, there's an expected death rate, but there's an excess death rate. Certainly the volume compared to the peak of COVID is not the same, but we're still above an expected death rate. And there are a couple of theories in there. I didn't want to get bogged down in that, but there are just a couple of hypotheses. I think one was delayed care. And I remember in the early days of COVID, Mark, a lot of people are like, man, we're shutting everything down, and all of the preventative stuff we've been trying to build a muscle in healthcare. So a lot of delayed care may be manifesting itself in excess mortality. Second hypothesis, indirect effects of the pandemic restrictions. I mean, gosh, man, suicides, social isolation, anxiety, unemployment. And then the third hypothesis was the long-term effects of COVID, that the long-term effects that it does to people's bodies and might be manifesting itself now. And then there's another theory they're talking about, which are kind of reinfections and what that's doing and wearing people's bodies down. So interesting article. The stats what kind of blew me away. 300,000 excess deaths compared to the past. And I'm going to actually delve into that more in the show coming up with Jay Cushman about just total death data, etc. Next one was False Claim Act settlements exceed $2 billion. Of that, I think almost all of it, not quite, but the vast majority of it was healthcare. I think it was like 1.7 billion. So the government continues to figure out that they spend money in this area, they get money back. And so this one particularly was for false claims and came from whistleblowers, et cetera. But over $2 billion came from that. And unfortunately, I think it just continues to feed this audits and all the craziness that a lot of my peers are dealing with. The next one was Leading Age, and kudos to Leading Age. They actually went out to Congress. So I'm starting to see a movement. Of course, I'm very close to NPHI, National Partnership for Healthcare and Hospice Innovation. But Leading Age is one of the first to actually approach Congress about reforming the hospice benefit. So, Mark, I know you're, in some respects, I feel like you're one of those pioneers that I've got to benefit from making my life's work in this, but there's a great movement of how do we design the benefit for where it goes in the next 40 years. And Leading Age actually kind of shopped a kind of a broad approach to Congress. Some of the couple of things in there: greater access to palliative care, concurrent care, some interesting things around like in-home respite, etc. So that's one that jumped out at me. This is a big one, Mark. This next one, CVS Health, $10 billion bid for Oak Street Health, for acquiring Oak Street. Some of you don't know who Oak Street is. They're a very large primary care provider. They even have home-based primary care in their capacity. So important, Mark, you and I might do a show on this, but attribution feels like it's the gold rush of healthcare right now. Like, why would I want primary care? And why have hospitals for years purchased primary care practices? And so we see now the rush for care in the home. But like, if I'm going to do care in the home, I need attribution capability and competency. So you see CVS, not only did they acquire, so Oak Street's the latest, but I think it was Signify. I may be saying that name wrong. Yep. So it was Signify. That, trying to remember, that was another multi-billion-dollar. Yeah. They acquired for $8 billion Signify Health as well. So CVS is really pumping up its capacity for primary care and also primary care in the home. Next one. So CMS overhauls hospice survey process. So there is about a 196-page memo, and there's some, if there's any hospice leaders going, oh my God, I didn't know about that, you definitely want to get your hands on that. There's a lot in there that's going to drive what our surveys look like in the future, some of which we're talking to a lot of national experts, and we're scratching our head at a few things in there. Like, did they really mean that the way it's actually written? So it's a 196-page revisions to Appendix M of the State Operations Manual and CMS Hospice Basic Surveyor Training. So it's going to be trickling down and coming to a survey near you in the future. This next one was a little bit of a head scratcher. So ADL, so our activities of daily living limitations, fall by 18% among American senior survey. So it's a little surprising. Timeframe researchers analyzed between 2008 and 2017 data conducted by the U.S. Census Bureau. But over that period, 18% fewer adults aged 65 years or older experienced limitations in activities of daily living, such as bathing and dressing. Also, 13% fewer adults reported functional limitations like walking, stair climbing. So the number of disabilities as people are aging was less reported. Now, maybe people are aging healthier. And so, Mark, when I think about our baby boom generation, I think we're on the crux of a very interesting shift. The greatest generation has been who we've cared for most of my hospice career, now 28 years, and now baby boomers. And so less ADL limitations is kind of interesting. So that's probably going to take a little bit more research, because first glance, it was like, is that right? And then looking at the data, I'm like, okay, I could rationalize that because generally the baby boomers have tried to age healthier, maybe compared to the prior generation. Next, so this is speaks to one that you spoke to. In fact, I think I have two on the theme of nursing challenges, but nursing understaffing is becoming more deadly for patients. So this actually has some statistics about mortality rates where nurses, so it says more than 70% of nurses working in direct patient care said they're frequently assigned an unsafe patient load, and then some correlation to increased mortality related to that. So that was an article that caught my eye, which maybe segues to this next one. Nurses have solutions to the staffing crisis. And here's the punchline: if leaders will listen. And so basically listen first, then act, tap into their nursing knowledge. I know that sounds like such common sense. And also a key one here is let go of what isn't working. But related to the staffing challenges, when you look at the volume of the silver tsunami still coming, it's only going to get more difficult. So nurses having a voice, finding their voice. So that was a really good article with a couple of pearls. This next one, I think probably comes out of the ProPublica kind of ripples in the water, if you will, but Representatives Van Dyne and of course Blumenauer lead bipartisan letter calling for increased oversight of unacceptable fraud and abuse in hospice care. And I think you're seeing that already. Kudos to, I think last month, Mark, both you and I picked the MPHI coming together with three other organizations, NHPCO, NOC, and then also Leading Age, to say, look, what ProPublica pointed out, that's not what we're about. That's not about the members that we want, and we do need to increase scrutiny. So it's interesting that this definitely gaining some ground. And then the last one I did, a little bit of tip of the hat to you, Mark, but obviously a tip of the hat to President Carter. And you and I haven't talked a lot about him. And politically, I maybe not have aligned with President Carter, but one thing, no matter where, I think we live at a time in our country where you pick your side. But if there's anything you could say about President Carter, he had a heart of service. And I think his latter chapter of his life and how he led as someone who was an ex-president and Habitat for Humanity, he had a heart of service. And I think it's pretty appropriate. Mark, you might agree or disagree, but just all of the, even in his hospice experience, he is serving his country, which I find, I've always said, I want to be wrung out whenever I leave this world. I want my life to be purposeful to the end. And I think he's actually, he's doing that, and intentional or not, he's just really helped bring something that for many years we've been trying to educate people on what hospice is really about. It's about truly living to the end. So I don't know if you want to make any comments to that one.
I have a relationship with the Carter Center as a donor and as a former staffer, and the person with whom I interact most often knows that I work in hospice. And when she sent us an email, my wife and me, right as the news was being announced, she said that the Carter Center chose to do it this way specifically to highlight hospice and promote the good that hospice can do. So they were very intentional about that.
That is awesome. Thanks that affirms my theory about what a incredible heart he has and a heart of service. And man, we could all use a good dose of that today's day and age. Well, I almost want to end there, but here's my honorable mentions that I had as well. So the Hospice Florida pauses enrollment at 7 nursing schools because of the degree scheme. Like, come on, man, we need nurses. So what a horrible situation that may have ripple effects in the future as far as volume of nurses. But obviously you get why they're doing that. My grandmother died at home just as she wanted. It cost $145,000. So a family's journey, and they had financial wherewithal, and they brought in private duty as well as hospice. So I thought that was an interesting article. It had an interesting article about 2023 perspectives of several hospice industry leaders. Got my honorable mention. Legislator introduces new bills to remove hospital tax exemptions. Quite frankly, until I met Mark, that was not even on my radar screen. And those always give me a little bit of pause because of most of the members I work with are 501c3. So hospitals are going to be assailed on that front more and more. Senior living operators are finding a 4-day work week is actually helping increase job applications. So getting more flexible in staffing. Of course, the hospice audits surged in 2022. That's just one that many of our members are feeling. Nebraska-led nation in nursing home closures in 2022. This is something I know as a CEO, I felt we were going to get to a day where you're going to see a shakeout of that industry. I thought it had been much sooner, but obviously COVID just created such a great challenge to that industry, and you're seeing a lot of closures there. Virtual reality is not a toy, but is it healthcare was an interesting article. And then one about physicians, doctors not burned out from overwork. They're demoralized by basically the tasky and lack of purposefulness in what they're doing. And then one that we're going to have to, my guess is Mark will be talking about this in the next couple of months, but municipal bond defaults as distress continues to increase. And so we're getting into that season when a lot of bonds are actually re-looked at in healthcare. So a lot of stuff to look at. So Mark, thanks as always. Any final words from you, and then I'll wrap us up?
I think you mentioned the skilled nursing closures in Nebraska. That encompasses a lot of things. Nebraska was one of the states where a company that had basically no background in skilled nursing leveraged some money and bought up about 100 nursing homes in states like South Dakota, Arkansas, I think. They were based in New Jersey. Headquarters was over a pizza parlor. And Nebraska was ground zero when they went bust. So I think some of those Nebraska closures relate to that. But, that gets into private equity and lack of transparency on who owns nursing homes, which may also, at some point bleed into home health and hospice on the for-profit side. It's just there's a lot of pieces of rural healthcare deserts, a lot of pieces in that Nebraska story that are going to be with us for a while.
Wow. Well, Mark, thank you. And a couple of things I want to leave our listeners with. I heard someone say this the other day, that we live at a time because of social media that we are kind of pushed on a day-to-day basis to do you agree or disagree? What I think Mark and I want to do with this show is two things. We want to be of service to you, busy hospice and palliative care leaders dealing with so much. But number two, we want to get you to think. And there are probably some interesting threads that you keep pulling on these articles that the more that you know about these subjects, the better you're going to be prepared in your day-to-day job to navigate some pretty unprecedented times. So given that standard, give Mark and I some feedback as we go forward. Are there some articles you feel like he and I missed? Please give us that feedback, and then that'll help us continue to be a good service to you throughout this year. So Mark, as always, thank you. Appreciate you. And always want to leave our listeners with a quote that makes them think. And this one's from John Maxwell. You need to remember what happens in you is much more important than what happens to you. Thanks for listening to TCN Talks.